Good morning, Dr. Kiltz.
Good morning, Lisa.
How are you?
Awesome. Happy New Year.
Happy New Year to you, too, as well.
It's a beautiful day.
It is. It absolutely is.
Nice, and we're in the freezer, I say, in upstate
Yes.
New York. But it's really beautiful, and the snow is great, and you just got to slow it down.
Mm-hmm.
And part of the slowing down is mindful.
Absolutely. Becoming a little bit more aware. I love the wintertime because we all retreat indoors a little bit, and it gives us a greater opportunity to do a nice assessment, a self-assessment of how we're doing, where we want to improve and where we can grow and where we can let go a little bit. And at our Circle of Hope support group session this week, Sherry Ramsgard from Whole Mental Wellness is going to present on mindfulness. And she's a great psychiatric nurse practitioner who we can access and we can use as a resource. And she's going to share some great tips on remaining mindful of not only our emotions, but how our body is feeling and what we're putting in our body, and how to keep tabs on ourselves so we feel like we're in control.
And I've always said, and I practice and I work on this for myself every single day, is the only thing we control is what we think.
Absolutely.
And so in the moment of taking the breath, it's a pause, and in the pause, it allows us to refocus and rethink and imagine somehow this is all good for us, and we will get through it.
Yes.
And in being mindful, we slow it down. Our cortisol and epinephrine levels go down. Oxytocin and serotonin levels go up.
Yes.
And it allows the body to function better.
Absolutely.
Between the gut and the neuromuscular system, and as we're talking about, the reproductive system,
Yes.
it will function when we begin to slow it down and be more mindful and visualize that which we desire will unfold and happen.
Absolutely. And I've had many clients come to me and say, well, once I was able to take a look at the stress in my life, what I was focusing on, and maybe I let go of my work stress, or I let go of a relationship that wasn't completely supportive, or I reframed my approach to one particular area in my life, I was able to free up some space and I was able to conceive. My body felt like it was able to work better. And so being mindful isn't about looking at all of your stress and all of the things that impact you during the day and saying, well, I'm just never going to be stressed again, I'm never going to worry again. But really taking a look and seeing where we can improve in small increments, slowly.
I believe, and it's been talked about, and that we can't live without stress.
Yes.
And friction is necessary in the heating up and the change and the growth. And in that stress and friction, somehow in that breath and slowing down, you reframe the brain and imagine that what you're experiencing is actually good.
Yes.
And valuable. And my friend Steve Wexler talks about love and how we can open up to love.
Yes.
And the word love, and in words, when we look at someone, we tell them we love them, it makes us all feel better.
Yes.
And it touches the cells of our body and helps them just kind of well up with more joy in this journey that is challenging, which is meant to be. But it's in the challenges that the really good and amazing come for each and every one of us.
Absolutely.
And so the practice is mindfulness, and Sherry's going to come and
Yes. This
share
week,
with us.
Yeah, we're going to share some great tools. We'll do a recap and post it on the website for our clients as well. And she's going to be joining us over the next few months. Next month, we're going to be talking about processing grief and loss as well. Again, sharing incredible tools that you can take home and really work on, not just during the session, but in your everyday lives. So be on the lookout for some more great resources with that.
Well, I wanted also to talk a little bit about what we're doing at CMY Fertility
Absolutely.
in the new year. And I've developed a new focus that the science is very important. It always has been. And many people, I think, sort of have this idea that Dr. Rob is just about mindfulness and isn't touching on the importance of the science of Western medicine. And we're here to share that in a mindful way.
Absolutely.
And the research is really telling us that we can be a lot more caring and focused on the support of the early luteal phase,
Yes.
early pregnancy. And much of what I want to do here is we're working on our protocols to share them with you and with all of our staff, that we can take it from, all right, you want to prepare the body from the beginning,
Yes.
which begins with the mindfulness, with what you put in your body. And I talk about low carbs, eat less,
Yes.
get rid of sugars, and carbs overall are not as good for people as they've been made out to be.
Absolutely.
And so lower that, and move with mindfulness. But exercise is very good because it helps us feel better, and when we can look in the mirror and feel better about ourselves, that's so critical. But the science tells us, and I've had many patients recently that have been on a low carb,
Yeah.
no carb, no sugar diet, have been increasing their mindful exercise, have used the extra pounds they carry, and have conceived.
Yes.
When previously, despite all the great things, they hadn't. So I want to really focus much on how do we improve the body, first of all. And then when we're using our protocols, how we select, and we have a lot of new protocols where we're using more letrozole,
Yes.
which really helps with implantation along with the ovulatory dysfunction. Focusing on lower, kinder stimulation with
Yes.
gonadotropins, and eliminating ovarian hyperstimulation with more use of antagonist, agonist cycles. And we're also looking to move more towards freeze-all cycles.
Yes.
So we do see that the endometrial lining and the luteal phase may be dysfunctional for many people, and by freezing embryos from an IVF cycle and in a more natural cycle, we actually are seeing better pregnancy rates, and our intention is to make that more and more available. And I'm kind of talking on a little bit here, but I want to kind of compact,
Absolutely.
tell everyone a little bit about what we're really focusing on. And then the luteal phase, after ovulation, really critical. In everyone, we need to be checking progesterone levels, estrogen levels, and treating appropriately. And if it isn't vaginal estrogen, progesterone, there's a lot of evidence to show that intramuscular progesterone
Yes.
quiets the uterus. It reduces the motion of the uterine lining, which may be a factor in early pregnancy loss, ectopic pregnancies, or failed pregnancy altogether. It's a little bit more painful and challenging, but we believe that it really helps.
Absolutely.
And then on the immunologic side of things, we're looking more and more at the fact that we know that normal pregnancy requires a normal immune system. Diet, carbohydrates and sugar cause a dysfunctional immune system, and you got to work on that. Once we can help regulate that part of it, in some cases it may be adding low-dose steroids, it may be adding things like Neupogen, Lovenox, intralipids, intravenous immunoglobulins, but also just really watching the early pregnancy and treating appropriately throughout the whole early first trimester up through 12 weeks. And that's what we're beginning to do. The CNY fertile luteal phase and early pregnancy support is something that we're moving towards, and we think we're there. And if you have questions, please,
Absolutely.
if things haven't been working, don't give up. Be mindful, be persistent.
Yes.
And we all are changing so many things. One other thing, our clinical team and our laboratory team are all on task here to come together with all the necessary changes: temperature, lighting, techniques, pH, and being mindful of every single one of those things.
Absolutely.
And I'm committed to continue to make CNY Fertility the leader in affordable fertility care, and making sure that you get the proper emotional and physical support throughout the procedure and the process. And really, it is a journey that I'm grateful to Lisa for helping us and support, and all of those, and this entire team at CNY Fertility. My gratitude, and Happy New Year. And 2015, we're going to help make it happen and build your family.
Thank you very much for sharing and this wonderful energy moving forward in the new year. I know our clients will love it and appreciate it, and we're so excited to see the changes that will come with our mindfulness in regards to protocols and changes that we're making here at the center.
And if it hasn't been working, my cell number 315-416-9872. Text me,
Yes.
and I'd certainly be glad to give you a call, put you on my schedule. I do free phone consultations and free phone follow-ups. It is a challenge in the wintertime to travel, and sometimes there's just a quick question that needs answering, and you need to be able to get that answered. And we're working on our phone systems and our communication, and if it's not happening properly, please let me know so I can help make it better.
Great. Well, thank you so much. And everyone, we hope you have a wonderful new year, and we will see you next week.
Awesome. God bless. Enjoy.